Hi.
What's your name, where are you from, and why did you come here?
Diana Yakney. I came from Canada, and I came for treatment for my son for Autism Spectrum Disorder.
When was your son diagnosed?
At 3.
And how old is he now?
He's 8.
Okay, how has the diagnosis affected your daily life in general?
Oh, it affects every aspect of daily life. In terms of him, difficulty communicating, speaking, expressing what he wants, behavior, hyperactivity, unable to sit and concentrate and do regular tasks, like daily living kind of tasks, really from every aspect of the day, from waking up to going to bed.
Did you try any other treatments before coming here?
Oh, yes. In terms of treatments, we've done, and we continue to do, ABA therapy, speech therapy. We've tried dietary changes, anything that we've kind of come across. What's the other one? Occupational therapy, every kind of therapy there is.
So did any of those therapies made any changes?
Yes, they have, but in terms of big improvements, it's kind of been slow and gradual. And my son has also experienced regression, where he had words, he had other milestones, they've kind of gone away. So his communication is worse than it was before. So he was able to communicate better when he was younger than he does now.
And what was the deciding factor for you in choosing stem cell therapy?
Watching, one of my friends mentioned this clinic to me, and then I found it, and then watching a lot of YouTube videos, other people's testimonials, doing my own research of what it actually involves, what it is, that it's generally in terms of the risk, it's nominal, it's very, very small, but the potential, if there's a chance that it can help, I think it's worth it.
Yes, of course. And what are your expectations for the long-term results of this treatment?
I'm hoping for the best possible result that he could have. I'm hoping that he'll start talking again and communicating, and
Yes, we're all hoping for that.
Yes.
And can you tell us about your experience at Swiss Medica? How did your child react to the treatment?
Oh my gosh, way better than I thought he would. Just because, one, we're coming from a different country, the travel, whatever. So his adjustment's been very, very good. In terms of, he's never had his blood taken before. So in terms of doing the blood test, the initial stuff, they were all really, really good. Made him feel comfortable. He didn't even cry, really, when they were doing it. Just a little bit of fussing, right? It's uncomfortable a little bit, but he was great. So the nurses, the reception staff, the doctors, everybody is very, very professional, welcoming. And even from the kitchen staff, everybody's been very nice.
Have you maybe considered any other clinics apart from Swiss Medica?
I looked into it just because I was more curious, right? I'm coming from halfway around the world.
Yes,
is there anything for me closer? And I couldn't really find anything. I think in terms of and you also want other people's testimonials, reviews, that sort of thing. So I looked, but I couldn't find anything that was comparable in terms of, how many people have, recommended it, have had good experience and all of that stuff. So I didn't consider any other ones.
Did you have any fear coming to Serbia? Or?
No, but for me, I'm from Serbia originally, so for me it was easier. So I knew where I was coming. But this country has everything. In terms of people, in terms of transportation, in terms of whatever, it's very comfortable. You have every possible amenity, and the clinic itself is like any clinic I would think that you would go into the US or Canada or whatever. So.
And what would you say to other parents considering stem cell therapy for their child?
100% you have to try it. You have to try it. I haven't even seen any results. I'm watching now and I'm looking, and maybe I'm imagining it, I'm noticing little things or whatever. They say, it takes up 3 weeks after your initial one to actually see any kind of potential improvements. But I mean, in terms of just his overall demeanor, how he's acting, I'm not seeing anything negative. Like there's good eye contact, there's good things. He's asking me to hold his hand like when we're walking, which is great. Like, so I don't know.
You noticed any changes since therapy?
Maybe I'm imagining it, but I think I've already noticed it. You know, I mean, he's comfortable. This is a completely new place for him, and he's comfortable here. He's at ease. You know, he wants to go out, he wants to explore, he wants to do stuff, and limited behaviors in terms of getting too frustrated or anything like that. And I also like here that they have, you know, the other speech therapy, right? It's offered after the treatment. So he's great with the speech therapist, and there's different languages offered and whatever. So I think that's a big plus too.
And a few more words about our facility. This is our new facility.
Yep.
And about medical stuff, about food.
Yep.
Was everything good?
Everything
okay?
State of the art, I would say. Just the apartment alone, it's very big, it's spacious, clean. Just having, you know, you kind of feel like you're at a hotel, really, which is great. Like, right, you're coming to a new place, you want to be comfortable. The food has been excellent in terms of choices. You know, every breakfast, lunch, and dinner, there's always a few different options. You're going to find something that you like. The cappuccino's been great. Coffee's been good. Staff, everybody's been really good in terms of like the front desk staff. You know, if you're going somewhere and you're gonna be not back for dinner time, being able to order your food and then it being ready for pickup, it's just helpful. In terms of the doctors, in terms of the nurses, they really know what they're doing in terms of, you know, like I've had my blood drawn as an adult. Sometimes they miss my vein 5 or 6 times. Like they get it on the first time. They really seem to know what they're doing. And it makes it obviously more comfortable for the child. They're not getting more like upset. It's to try to keep everything as calm as possible.
Thank you very much. We all wish you all the best.
Thank you.